Good day, everyone. We're happy to have you join us on yet another webinar of the Yaba Voice of the Federal Neuropsychiatric Hospital, Yaba, Lagos. I hope you're doing well and I hope you're staying safe. There's so many stressors out there, so many pressures, but I hope you're keeping fit and you're coping adequately. And you know, we're so concerned about your mental health when it comes to all of this at Yaba Voice. And that's why we're talking about something very, very important again today, something that would help you to be able to stay well both psychologically and also physically. But before we run into the discussion today, the head of clinicals, Dr. Okay, so before we run into the discussion today, we would have the head of clinical welcome us formally to this webinar. Please just sit back and quickly, just prompt one or two people that we're here and we are ready to go on today's discussion. All right, so let's have the head of clinicals welcome us formally to this webinar today. Over to you, sir.
Thank you. Afternoon, distinguished ladies and gentlemen.
We can't hear him.
Good afternoon, distinguished ladies and gentlemen. On behalf of the medical director, Dr. Oweye, and the entire Yaba Voice team, I want to welcome you again to Yaba Voice, the platform that is dedicated to disseminating and creating awareness about pertinent mental health issues with the goal of addressing misconception and empowering our people to take appropriate action as far as mental health issues are concerned. And from the feedback we've been getting from you, we know that we have been achieving this. Today will not be a different. And today we are addressing another important topic, which is psychological implications of physical illness, prevention, and management. In the profession of medicine, illnesses are often categorized as physical or mental, but this is just for convenience sake, because the body is one. What affects your limb might have effect on your brain. What affects your liver will ultimately affect your brain. And as you shall see today, what affects your brain may also result on or cause effects on other parts of your body. And this issue is often overlooked, even by the medical profession itself, while attention is placed only on physical illnesses to the detriment of the patient in a way that may affect the cause and the outcome of illnesses. And that's why we consider it necessary to bring up this issue and address it. And to do justice to this issue today, we have two eminent personalities. The first person is a teacher of teachers, an erudite scholar, a doyen of psychiatry, who has dedicated his life to study this area in the field of mental health that we are discussing today. I talk of no other one than Professor Olatunji Aina, a professor of psychiatry at the College of Medicine, University of Lagos. We are privileged to have him here with us today. And I can assure you that at the end of this program, you will agree with me that we are privileged to have him because we'll be bringing his wealth of experience to discuss this important issue. I promise you, it's going to be educative, it's going to be refilling, and it's going to be entertaining. Professor Olatunji Aina graduated as a medical doctor from the University of Ilorin in July 1989. And after his housemanship and 1-year compulsory national youth service, he proceeded for his postgraduate medical training to specialize in psychiatry and was awarded fellowship of West African College of Physicians in 1997. Thereafter, he worked briefly as a consultant psychiatrist with the Crest Consultant Clinic in Ikoyi before he was appointed as lecturer 1 in the College of Medicine, University of Lagos in October 1999, an honorary consultant psychiatrist at Lagos University Teaching Hospital in June 2000. From then, he has risen steadily through the rank to his present position of Professor of Psychiatry in 2015, and is currently the head of department, College of Medicine, Department of Psychiatry, College of Medicine, University of Lagos. Over the years, until date, Professor Aino has held various administrative positions in the services of the university. He's an external examiner to various Nigerian universities, and is also an external, one of the examiners with the West African College of Physicians. And over his career, he has successfully supervised over 26 medical doctors in their postgraduate program. These ones have also become teachers. That's why I call him a teacher of teachers. Some of his students have now become consultants and senior consultants. Some of them have also become professors. So you can start to understand the caliber of the person that we brought on today. He has attended numerous national and international conferences, and he has delivered head talks in various gatherings and over electronic media. He's the immediate past editor-in-chief of the Nigerian Journal of Psychiatry, the official journal of the Association of Psychiatrists in Nigeria. His area of research interests are transcultural psychiatry, consultation liaison psychiatry, and child and adolescent mental health. He has over 70 publications in both national and international journals, as well as being co-editor of 3 textbooks of psychiatry, 2 of which were published in the United Kingdom. Ladies and gentlemen, like I said earlier on, we are here for an exciting time today to learn from this erudite scholar. And the second expert that we have brought on today, I call her Doctor of Doctors. She's a consultant family physician who graduated a few years back, but has contributed immensely to the field of family medicine in Nigeria. She's a fellow of West African College of Physicians. And after her housemanship at the Federal Medical Center, Yaba Voice, and her national service, she went on postgraduate training to become a fellow of West African College of Physicians and specializing in family medicine. In the past few years, she has been working and manning our staff clinic at Federal Neuropsychiatric Hospital Yaba, and she has been doing a very, very wonderful job attending to staff and our clients, our patients who have physical illnesses. So you can agree with me that she's eminently qualified to talk about this issue because she can see, as she has been able to see, both sides of the divide. Ladies and gentlemen, I want you to sit back, listen attentively to learn from these 2 eminent experts as we talk about the psychological implications of physical illnesses. Thank you.
Thank you so very much, Dr. Oluwani. Thank you for that rousing welcome, and thank you for welcoming also our guest speakers for today. Thank you for the information also that you have given on the topic today. And like he said, we're looking at psychological implication of physical illness, the prevention and management. Oftentimes people are sick, but then they tend to also be sick psychologically. And sometimes there are no clear delineation. And that's what we want to look at today. Please, if you know somebody who needs to be here, please tell them that this program has started just for 1 hour. It's not going to be a time lost in any way. Just for 1 hour, we're going to be here talking about this very important discussion. If they are not able to join us on the Zoom platform, please, they can also join us on the Facebook page of the Yaba Voice. Yaba Voice, one word. We're there on Facebook and we're streaming live. And so you can also join this program as we're going. And so we are raring to go urgently now because we don't have so much time. And we will start the discussion with Dr. Adegbite, and Dr. Adegbite would open up with us and tell us what are some of the physical health issues that are prevalent or they are so peculiar to our environment, and let's look at what are some of the possible causes that we can find. Over to you, Dr. Adegbite.
Thank you, Madam Moderator. The medical director, ably represented by the head of clinical services, Dr. Oluwani, members of the Yaba Voice team, co-speaker, Professor Aino, my senior, my teacher, online participants, good afternoon, everyone. It is a great pleasure to be here on this program today. Physical illnesses, as we have had, are sicknesses or diseases that impair normal physiological function and anatomical structure of the body. They occur in the body and not in the mind. However, depending on their nature, they can impact on mental health. So I'll try to categorize them, give examples, and possible causes of those that are relevant to this discussion. The first group I'll talk about is chronic medical conditions. These conditions run a long course. They last at least 1 year, but will last a lifetime. And the patient requires ongoing medical attention. Example of this is sickle cell disease, albinism, hypertension, diabetes mellitus, cancer, arthritis, heart diseases, epilepsy, and asthma. Sickle cell disease and albinism are inherited genetic disorders, while hypertension and diabetes are lifestyle diseases. Although they may run in families, meaning that they have genetic predisposition. However, it is the lifestyle that brings out the illness. It is often said that gene loads the gun, while lifestyle pulls the trigger. So I'll move to the next group, which is terminal illnesses. Death seems inevitable in terminal illnesses unless something drastic is done. Examples of this are advanced cancer. You remember I've said that cancer is a chronic medical condition, but advanced cancer becomes terminal, maybe stage 4 cancer of anywhere. AIDS, which is advanced HIV infection. End-stage organ failure, in which the kidney, liver, heart, or other organs might have failed and need replacement. The causes of this include viral infections, exposure to carcinogens, like cases of cigarette smoking, and in the case of organ failure, poor management of chronic conditions. Most hypertensive patients who poorly manage their conditions might develop some of this end organ damage and failure of the organs. I'll now move to infectious diseases. In infectious diseases, these conditions are transmissible from person to person. So you are aware that you can transmit it to others. They are aware that they can't get it from you. COVID-19 is an example. HIV, hepatitis B and C, tuberculosis, polio, measles are examples. And I've seen people that have permanent, maybe deafness or even blindness from childhood measles. So viruses and bacteria are the causes. Acquired disabilities from possible injuries, maybe road traffic accidents. And what is the issue here? Loss of independence is a problem. It could result from injuries like road traffic accidents, in which a patient might end up having a spinal cord injury or head injury. Patients may end up on a wheelchair or maybe bedridden. What are the causes? Well, bad roads, poorly maintained vehicles, bad drivers, or even poor healthcare systems and facilities are the causes. Because if the facilities are there, the outcome for the patient may be much better. Stroke is not an injury, but it's a patient that has stroke may end up with a permanent disability. So it is also an acquired disability. Body disfiguring conditions, obesity, patients that are morbidly obese, or alopecia. Alopecia means hair loss. It may not be a problem in men, but it's a lot of problem in women. You can imagine alopecia totalis, in which a patient has no hair at all on their head. Keloids is another. Keloids occur when a patient has an injury, but instead of healing fine, the scar continues to grow endlessly. It could be from ear piercing or other scars. Vitiligo, in which there is discoloration of the skin. Burns is another example. The skin is badly scarred with contractures across joints and neck in burns. Autoimmune diseases are some of the causes of this. For example, alopecia is an autoimmune disease. And when we say autoimmune, it does mean that the body is fighting itself for reasons that are not very clear. Accidents are some other causes. Congenital abnormalities or developmental brain disorders are another group of problems that could cause psychological illness in patients or their caregivers. Let's talk about parents of such persons. Examples of such diseases are hydrocephalus, autism, cerebral palsy, hole in the heart. It is not the patient in this case. Some of them are not even aware of themselves, but it is the parents or the caregivers that face the pain of the condition. Causes include maternal infections in pregnancy, accidents of birth, or genetics. Also talk about primary infertility, in which persons are desirous of having their own biological children, but it's not possible. Erectile dysfunction, fibroid, and acute conditions may also cause psychological issues if there's a delay in managing them. The list, honestly, is endless, and we cannot cover everything in this discussion, but those are a few causes of physical illnesses that may impact on psychological health. Thank you.
Thank you so very much, Dr. Adebite. She had read out to us some of the peculiar physical health issues that is so prevalent in our environment and some of the causes. I want us to begin to look at around us so that we can begin to look at that we're starting from this foundation so we can begin to build up and have the basic understanding of how all of these things now connect. And so we're going to go over to Professor Aina, who is going to tell us what are the psychological factors that are involved in physical illness and some of the possible symptoms that we can also see in this. Over to you, sir.
The medical director.
Unmute yourself, sir.
Good afternoon. The medical director, Dr. Owueye, ably represented here by the head of clinical services, Dr. Oluwaniyi, the members of the Yaba Voice team, distinguished patients all over the world, and I pray for healing on you, as well as the listeners. So, what are the psychological factors involved in physical illnesses? Thank you, Dr. Adebite. I've tried to explain the interrelationship between the body and the mind. Anything psychological can affect the body of an individual. And we are aware there are some psychological factors that can predispose or precipitate physical illnesses. One of them is that of attitudes, our attitudes or behaviors. Some of them include trivializing physical illness, the diagnosis of physical illness. When an individual trivializes the diagnosis of physical illness, this can make the physical illness to be worsened. There was a life scenario in the past. During my youth service, a man was told that he had hypertension because the blood pressure was very high. And the man said, well, he was physically fit and he didn't believe this issue of being hypertensive. Less than a week after, he was brought back to the hospital with massive stroke. And he lost his speech and half of his body was paralyzed. So when an individual trivializes the diagnosis of physical illness, it's a big problem. Another important attitude or behavior is that of nonchalant attitude to the existence of physical illness in an individual. When nonchalant attitude is shown, this can make the physical illness to be worsened and sometimes can even claim the life of the individual. The wrong prioritization in life. Quite a number of people do not give appropriate priority to their health or well-being. They give priority to something else like pursuance of wealth, pursuance of daily bread, and so on and so forth. These are important, but health is number one issue in life. And that is why the popular adage that says health is wealth. So quite a number of people do not necessarily prioritize health as one of the important issues. And this is a psychological problem that can affect physical illness of an individual. Then another important psychological factor is our personality makeup, the type of personality of an individual. This can greatly affect the physical illness in an individual. Some people have a lot of passion for themselves. That is, they are concerned about their well-being. And this type of personality disposition can enhance one's physical health. But on the other hand, some people may not show seriousness or even concerned about their health. It's their own type of personality. They're never serious about any issue, even including taking care of themselves. And this type of personality disposition can greatly affect the physical well-being of an individual. Another important psychological factor we must not fail to mention is that of stress, life stressors. And in Nigeria of today, we are aware about so many stresses that can affect the individual, the economic problems, the pervasive security issues, and so on and so forth. All this contributes to life stressors. And this stress can greatly enhance the occurrence of physical illness or can make physical illnesses to be worsened. Some of the examples of physical illness that can be worsened by life stressors include things like hypertension, diabetes, and various forms of heart diseases. All these can be worsened by life stressors or stress of life. And there are some illnesses that are categorized as psychosomatic illnesses in mental health practice. These psychosomatic illnesses, as the word depicts, psychosomatic, the word psycho means mental or psychological, whereas the somatic aspect means body or bodily or physical. These are illnesses in which psychological issues, particularly stresses of life, can predispose to the development of this illness or sustain or even worsen these illnesses. Some examples of these psychosomatic illnesses include peptic ulcer disease, bronchial asthma, and hypertension and heart diseases that I've mentioned, just to mention a few of them. So life stressors can affect all these illnesses. Even in the last few decades, research has shown that quite a number of cancers can even be affected or be worsened by stress. So life stress or stressors can greatly cause physical illnesses or even worsen them or make their treatment to be problematic. And another important psychological factor that can affect physical illness is that of denial of the diagnosis of the physical illness. Denial. When you tell a patient in the clinic that so and so physical illness is occurring in him, it is quite common in our environment for some of these patients to deny, especially those that are very religiously inclined. Some of them can claim to have faith and deny the existence of this illness. Why is this a problem in medical practice? It is a problem in the fact that some of them eventually, this physical illness get worsened and they don't seek for treatment on time. And sometimes by the time they come for treatment, it may be too late, or sometimes they can end up with complications that can be life-threatening. So another important psychological factor that can affect physical illness are what we call lifestyles. And you will agree with me that over the past few decades, westernization has greatly affected our way of life in Africa. This westernization, well, there are positive aspects of westernization, but there are negative aspects that tend to affect our well-being, our health. And some of these important variables in westernization include our diet. The change in diet, the tendency to consume more refined foods has been attributed as one of the causes of some of the physical illnesses, such as diabetes and hypertension. As a matter of fact, the Diabetes Association of Nigeria have released some reports to show that in the past few years, westernization has tended to increase the prevalence of diabetes mellitus in this part of the world. And this arises greatly from our lifestyle, the tendency to westernization, which can affect what we consume. And again, apart from food, even the consumption of psychoactive substances, for instance, alcohol. We know heavy consumption of alcohol can lead to quite a number of physical illnesses, most especially chronic liver diseases, kidney diseases, and even heart diseases. All these are fallout of chronic alcohol consumption. What about cigarettes? We also know that consumption of cigarettes, nicotine as part of lifestyle, can also lead to quite a number of illnesses. I will leave this to Dr. Adedipe to discuss later because it's largely one of her purview. Then again, another important psychological issue of concern to us with respect to physical illness is that of sleep. We know that westernization, pursuance of daily living and wealth has led to quite a number of people not having adequate sleep. For instance, in Lagos, quite a number of people do not have enough time to sleep. They have to wake up on time to beat the traffic to get to their places of work. And sometimes they also close very late. So at the end of the day, you discover that quite a number of Lagosians may not sleep for more than 4 to 6 hours a day. And this is grossly inadequate for our well-being. So sleep deprivation as part of our lifestyle or westernization, so as to pursue career, can affect the physical well-being of an individual. Then another important psychological factor of note that can affect physical illness is what we call state of hopelessness. When an individual displays this disposition, it can greatly affect the individual's physical well-being. Let me cite a typical example I was involved in some years ago. A lady was accidentally shot in the thigh, and she was brought to a hospital then when I was in private practice before joining the university services. And she was told she was to be amputated. And she expressed the fact that she was fed up with life. She was hopeless. And the second day, she was dead. So state of hopelessness can greatly affect the physical well-being. Thank you.
Thank you so very much. You know, when you have a professor in the house, just be ready. This is really, really deep, really, really deep. Most times we are not so familiar or conversant, or most times we trivialize. Let me use this word. Most times we trivialize a whole lot of those things, but it's bringing to the fore some of the germane things that will ensure that we live both physically and psychologically healthy, and then we're able to create a balance that helps us to be able to function adequately. Yes, we're going to move quickly to Dr. David, who is going to tell us the connection between physical illness and mental health. What is the link? Is there a bridge? What connects them? What's that dot? What's that bridge that connects physical illness with mental health? Over to you, ma'am.
Thank you, Madam Moderator. I'm happy that Prof has said quite a lot about physical dimension to psychological dimension, to physical illnesses. So now I'm going to say that the connection is multifactorial, and it's a two-way thing, meaning that chronic physical conditions can lead to poor mental health and vice versa. So I'm going to talk about biological, physical, social, and economic factors that link these illnesses. I'll start with the biological. Sometimes there is a direct connection between the physical illness and psychological issues. And I'll use brain injury as an example. Also epilepsy. If a patient has concussion, which means during an accident, the brain shakes violently within the skull. There may be inflammation following that. There may also be depressed skull fracture with direct injury to the brain or compression of the neurons of the brain. There may also be recurrent seizures in an epileptic patient. Following these episodes, there may be anxiety, agitation, confusion, anger, which can last for days or weeks, especially if the part of the brain that affects mood is affected. And recovery may take a while. So while the patient is still recovering, he may manifest all these psychological issues, and it is just a direct link. Sometimes surgery is needed to lift a depressed bone so as not to perpetuate the psychological condition or even seizures that the patient is experiencing. What about physical toll? Many physical illnesses take a toll on patients and their caregivers. There is a real and there is a perceived burden that is associated with physical illnesses. Let's talk about chronicity, for example. Some patients cannot just wrap their heads around having to take medications for the rest of their lives. I'll take hypertensive patients, for example. They keep asking questions. When am I going to stop my medications? But they are not going to stop. It's a lifelong treatment. That may bother them. Also, severity of the condition, the intensity, the time required to take care of such patients. You can imagine a patient that is completely dependent for everything. Some of those children cannot be let out of sight for a minute. They require attention around the clock. So, and you will admit that it's easier to manage a child who is dependent than an adult who is dependent. How are you going to carry an adult to the bathroom, brush their teeth, feed them, bathe them? It's quite difficult and agonizing for both the caregivers and the patients. The repeated admissions and blood transfusions, the clinic visits that you see in a sickle cell disease patient, the loss of manpower from the side of the caregivers, it's no joke. I'll now move to economic factor. Loss of wages, productivity, and sudden unemployment from permanent disability may be the link. The breadwinner is now bedridden. So who feeds the family? He has lost his economic power, and yet he has a condition that requires huge sums of money for treatment of the medical condition. It's like adding salt to injury. The financial and other resources required to manage certain chronic conditions are mind-boggling, and they may be beyond the reach of the common man. However, participating in health insurance can reduce medical costs and reduce costs of out-of-pocket expenses. Reduce out-of-pocket expenses. What if the condition is now not covered by health insurance? We do know that there are conditions like that. And the person who has chosen to live a quiet life may now have to go public for fundraising. Imagine a patient who needs kidney transplant. The cost of getting one done is no joke anywhere in the world. On the other hand, patients who are well-to-do may not feel burdened by an illness of this nature. Social capital is another factor that could be of help. In the community or individual, it is the community or individual relationships that provide help, support, and resources. And why is it important in healthcare? Social capital in healthcare creates tangible and intangible resources, such as healthcare management, advocacy, support, access to information, and care navigation. So the more social capital a person has, the better the outcome in terms of health for such ones. The quality of the services, as well as the availability, accessibility, and costs are other aspects that determine the outcome of medical care for patients. Those things may be available, but they may not be accessible because they are expensive. There are aspects of social environments that are, however, negative. What I've said earlier are positive ones. Somebody who is bereft of this social capital may end up with social isolation, loneliness, and exclusion. These are strong factors for psychological problems that follow physical illnesses. Isolation and rejection play out as key factors in people with disabilities whose peers have avoided like a plague. I think I'm also guilty. There was a time when I was a child, I went for holiday, and I saw another child with a birthmark on the face, one side of the face, and it grew here. It looked really scary. I couldn't move near to him. So such a child whose peers have abandoned, how will he feel? An HIV patient may find it difficult to have a committed suitor. Social stigma and societal discrimination breed low self-esteem in sick people. In societies like ours that think less of the physically challenged individuals, you may have a public building that has no elevators, no ramps. The patient wants to access the place, but cannot because he's on wheelchair. What happens? So he's reminded that he's handicapped. Their name calling and unkind remarks, words like you are barren. I wish there were no such words, you know. And then some call other people monsters. They give unsolicited advice. These and other issues are what constitutes the link between physical and psychological illnesses. I'll rest it here.
Thank you so very much, Dr. Adegbite. I recall some few years back, a young man walked into my dad's office and wanted to have a conversation with him. And he wasn't around, so I was called to receive and just to have a chat. And after everything, they wanted to do something on HIV and very brilliant ideas and every other thing. And as I was about to leave, he now shook my hand and said, do you know I'm an HIV? Oh man, you needed to see. It was, my reaction was not something I could even coordinate, because in my head, there was just a lot of gaga that was going on, like, hey, excuse me, HIV. And you know what Dr. Adegbite said here, which is also very germane to all of these things, is sometimes our reactions, our response, our words, they are very huge contributor to an individual moving from the realm of the physical, even to mental. And so that means we begin to watch our actions, watch how we relate, how we accept them, how we treat them. Those things are very, very important today. Oh, thank you so very much, Dr. Adegbite, for opening our eyes to all of this. And we're going to move over to Professor Aina, who is going to tell us the psychological consequences of chronic illness. What are those psychological issues that we see that would maybe exacerbate this issue that we are talking about? Over to you, sir.
Thank you, Madam Moderator. I'm very grateful to Dr. Adegbite. She has done a lot of justice to my own aspect of this discussion. Thank you very much, Dr. Adegbite. When we talk of psychological consequences of chronic physical illness, of course, as I mentioned briefly the other time, that there's a close relationship or intertwined relationship between the body and the mind. This was kickstarted by a man called Descartes, a philosopher many decades or centuries ago, that was trying to educate the public about the relationship between the mind and the body. So what affects the mind can invariably affect the body, and what affects the body can also affect the mind. And that gave rise to this issue of psychological consequences of chronic physical illness. To simplify this discussion further, I've categorized the psychological consequences to two major classes. The first, psychological reactions to chronic medical illnesses. And the second subcategory, mental illnesses that can complicate physical illnesses. When we talk of psychological reactions, these include one, blame. When some people fall sick, when they develop physical illnesses, particularly those that appear to defy the usual simple solution to the illnesses, they tend to blame themselves. For instance, they tend to blame themselves for their past activities that might have led to the physical illness. Sometimes they may be erroneous in this conclusion. Then they also tend to blame others for their problems. Blaming others in Africa is particularly worse among those that are very religiously inclined when they ascribe their life problems to the spiritual attack from other people. So they can blame others. Then sometimes, even when the situation becomes unbearable, some people can begin to blame God for their problem. Another psychological reaction that can be seen is that of anger. And this is a fallout of this blame. Anger against self, which is as a result of blaming self, anger against others, especially relatives that they may not be doing enough for them to get out of their problem, and anger against health carers, health professionals, anger against medical doctors, nurses, and other healthcare professionals taking care of them. The patients may believe that these healthcare professionals are not doing enough for them to get out of this problem. So anger can also be directed against God. They can be angry against God. God, why me? Begin to blame God for this affliction. So when these physical illnesses become unbearable, the patients can become angry. Another important psychological reaction is that of fear. And there are various reasons why they exhibit fear. Number one is fear of the unknown. If an illness becomes very chronic and very devastating, the patients begin to experience fear. What could be the outcome of this illness? Then also the fear of dying. The fear of dying. It is believed that even no matter how old an individual is, most time when they fall ill with chronic illness, they even fear dying. Then another reason why they fear is fear of being incapacitated. Some patients may believe even if they don't die, they can be incapacitated from this illness. So the fear of incapacitation, and again, the problems that can arise from this incapacitation. I'm happy that Dr. Adegbite mentioned this briefly the other time. Then another important problem, particularly in Africa, is the fear of abandonment. It is believed that when an illness becomes too devastating and chronic, there is the fear of abandonment by caring relatives. But I must not fail to mention, most especially in Africa, where we have the so-called end user paying treatment method for healthcare services, because the health insurance is not well developed yet, there's also the fear of bankruptcy. If an illness is very expensive to be treated, the patient can have the fear of spending all his or her life savings on this illness. So the fear of bankruptcy is there. Then again, another important psychological issue we often neglect is that of burden of care, because relatives are very much involved in caring for their sick, close persons. They have a lot of psychological burden, financial burden, physical burden, emotional involvement in the management of such patients with physical illness. So the burden of care is another important psychological reaction that relatives often experience in Africa when their very close individuals are sick. Now, let me come to the second subcategory, that is the mental illnesses that can complicate physical illness. I've talked about the psychological reactions. Now, mental illnesses that can complicate physical illnesses. One of the most important mental illnesses that can complicate physical illness is that of anxiety disorders. Quite a number of patients, when they have very serious physical illness, they can become very anxious. They can develop anxiety disorder. Anxiety can be a psychological reaction. It can also be an illness, especially when there are symptoms, very severe symptoms of anxiety. So anxiety disorder is an important complication of physical illness, particularly phobia and what we call generalized anxiety disorder. They can complicate physical illness. Anxiety disorder is often seen among patients with cancers, among patients with epilepsy, especially anxiety about imminent seizure when they are in public places. Then another important mental illness that can complicate physical illness is depression. Depression is often seen as a complication of physical illness in quite a number of patients with chronic physical illnesses. Chronic physical illnesses such as diabetes mellitus, such as heart diseases, hypertension, even peptic ulcer disease, cancers, all these can be complicated by depression. Then we also talk of acute organic brain syndrome or delirium. I must not fail to mention this because aside from chronic physical illnesses, there are quite a number of acute physical illnesses in our environment, such as infections that can be complicated by this acute organic brain syndrome or what we describe as delirium. We often see this among hospitalized patients. Patients that are hospitalized for medical illnesses, for surgical illnesses, and which invariably can develop these psychiatric complications of delirium. Then stigma. I'm happy Dr. Adebite extensively discussed on stigma. I must not fail to mention the issue of stigma as a mental complication of physical illness. Many of these patients that can be stigmatized are those with physical variables that can cause either disfigurement or can affect their beauty or can cause a lot of psychological reaction in the people. For instance, epilepsy, if they throw a seizure in the public place, this can be stigmatizing. And again, the old illness that seems to be neglected because it's been eradicated, leprosy. Leprosy can be highly stigmatizing that even they are always confined to live outside the cities. And some patients can also have this complication of the use of psychoactive substances, abusing alcohol, cigarette, or even cannabis. Sometimes the motive behind the use of these psychoactive substances is to erroneously use them as form of treatment for the physical illnesses, which on their own can give rise to other complications. The last but not the least is that of suicidal behavior. Suicidal behavior is seen as a mental health complication of physical illness, particularly in the so-called terminal illnesses and illnesses that seems to be very severe, like cancers. Patients with cancer are at risk of committing suicide when they undergo excruciating pain. And again, some patients with even complicated diabetes, complicated hypertension, complicated heart disease, some of them when they pass through very painful situations, or patients with chronic kidney diseases, some of them are known to be at risk of suicide or to carry out suicidal behavior. Thank you.
Thank you so very much, sir. Professor Aino had shared with us quite a whole lot of complications when he talks to, even for the ones that are personal to the individual, the blame, the guilt, the anger, why is all of this happening to me? Anger directed at self, anger directed at other people, anger directed at God. God, why did you allow this? Why me? Most times you hear people say, why me, why me, why me? Quite a whole lot of things happening like that and other things like that. Fear of the unknown and all of those things. And he also told us there are also complications like anxiety, depression, and so many other things. It was a suicidal tendency. They're trying to cut somebody's limb, and all of a sudden he won't be able to function, he won't be able to walk, do a whole lot of things. It comes with a whole lot of issues like that. And that's what Professor Aino had helped us to be able to identify today. So sometimes when we see people going through the physical form of the illness, which we can identify, there is a psychological chain or reaction that is going on too, that we must be aware of, that we must also be able to take care of. And that also points that to what Dr. Adebite said earlier, the fact that we need to also be mindful of what we say. Sometimes people will go and greet and say, that was what happened to this person. Hey, when you have cancer, this did not happen, this did not happen. Exacerbating the fear and making this individual to feel like, the hand has finally come for me, among other things. So that, thank you so very much, Professor Aino. Please note that you can send in your questions and your comments to the chat box. We'll try as much as possible to take it. I know that we are running far behind schedule today, but we'll try and send, if you can just send it as quickly as possible. Now, we'll go over to Dr. Adebite, who's going to tell us how we can improve our physical health and also prevent psychological breakdown. We're looking at prevention now. What can we do? How can we prevent all of this? Yes, I have a physical illness. How can I prevent myself from going down to the psychological end of it? Over to you, Dr. Adebite.
Thank you, Madam Moderator. Prevention is at 3 levels, namely primary, secondary, and tertiary prevention. I'll start with primary prevention. Here, the aim is to prevent occurrence of any illness in the first place. And since gene and environment are major determinants of health, there is not much that one can do about one's gene. And that is why it is said to be a non-modifiable risk factor for illnesses. But there is a lot we can do about our lifestyle. So that is a modifiable factor for illnesses. You remember the quote that I said in the beginning, gene loads the gun, but lifestyle pulls the trigger. So if you are two siblings, one is reckless and the other lives a healthy lifestyle, even if both of your parents have diabetes and hypertension, the one that chooses health, that has healthy choices, may not be diabetic or hypertensive, or may delay the onset until much later, while the one that is reckless may develop it quite early. This primary prevention include healthy food choices, physical activity, exercise, restorative sleep or rest, and stress management. Somebody asks a question on the platform and says, what kind of stress are we talking about? It is chronic stress. It is not acute stress. Acute stress may actually be protective, but chronic stress is quite damaging. We should also avoid risky behaviors like multiple sexual partners, unprotected sexual intercourse, illicit substance use like alcohol and tobacco. Prof said he was going to leave it for me. So let me quickly talk about tobacco. Somebody has to quit smoking completely, reduce alcohol, and maintain a healthy weight. There are also other positive steps toward disease prevention, which include taking vaccine for vaccine preventable diseases like hepatitis B and carcinoma of the cervix. Secondary prevention. In secondary prevention, the illness already exists. So the aim is to prevent complications of the illness. Examples of the hypertensive patient, that we have been talking about. If he's hypertensive and he wants to prevent stroke or kidney disease, then he must adhere to treatment. Adhering to treatment, seeing a professional, doing a follow-up are the ways to do secondary prevention so that he does not develop stroke and chronic kidney disease. Most patients who do not adhere to treatment will develop this. And albino should prevent skin cancer by protecting themselves, shielding themselves away from exposure to sunlight. And I'll now say that sometimes there is also a complication, but that can be quickly nipped in the bud, like a diabetic that needs an amputation of the toe, but he delays the treatment until the whole leg has to be amputated. So all those come under secondary prevention, prompt diagnosis and early treatment. Then tertiary prevention talks to complications that are already setting, and the aim is to minimize negative effects of complications, prevent further complications and relapse, and restore the highest physical and psychological functioning of that patient. Efforts at preventing psychological issues must come in here. A patient who has stroke must now begin, he already has stroke, so the deed is done. He now has to go for physiotherapy and receive counseling so that he does not fall into depression. In avoiding psychological meltdown, the patient must accept himself, his new condition. He must love the person he is now. He must boost his self-esteem. You know, I love this quote that says, God grants me the serenity to accept the things I cannot change, the courage to change those that I can, and the wisdom to identify the difference. So we can also help other people to cope. Time is going, so I want to round up. We can help other people to cope by not overreacting, you know, when things happen. We should resist the urge to turn our head and look at them. And people should avoid negative coping skills like taking alcohol and use of other substances. They should not also isolate themselves. They should join support groups. There are these support groups everywhere. If you don't know, please ask questions. You will be told and it will be helpful. Thank you.
Thank you so very much. You know, when we started, we said this topic is loaded, really, really loaded. I'm sure we just scratched it. We'll still come back sometimes in the future. But let's just round up at this point where we're taking Professor, who is going to tell us, okay, yes, when an individual who has a physical illness is now experiencing some form of mental breakdown, psychological distress, that's so emotional, difficulties, what's the best line of management? Sometimes we don't link it. People don't link it, but what's the best line of management, sir?
Thank you very much, Madam Moderator. And thank you so much, Dr. Adebike. You have really done justice to this aspect of my discussion. The primary prevention, that emphasis is very, very important. Primary prevention. It is better to prevent complications rather than treating it. And so I will just cap up this briefly, that once psychological complication has developed to physical illness, the management include one, appropriate and prompt management of the underlying physical illness. Our energy should be vigorously directed on the underlying physical illness so as to prevent further damage and to prevent further complications. And secondly, when a patient with physical illness develops psychological complication, it requires a lot of tactfulness, a lot of understanding on the part of the caring physician, as well as the mental health team that might be invited to take care of such patients. And in the management of psychological complication of physical illness, usually there's what we call mental health team. It involves the whole professionals in mental health practice, the psychiatrists, the clinical psychologists, the psychiatric nurses, the social workers, and sometimes the occupational therapists. All these are involved and they work as a team in the management of patients with psychological complications, depending on the problem. Then again, in the aspect of treatment, psychological treatment is much emphasized than the use of psychotropic medication. Psychological management in terms of counseling, then various forms of psychotherapies, particularly insight-oriented therapy. We want the patient to understand the physical illness as well as the psychological complications and the need to take the treatment of these illnesses very seriously. So that comes the insight-oriented psychotherapy. Then again, supportive therapy is very important here because quite a number of times patients appear to be very helpless and they need a lot of psychological support. And also, we even extend this to their carers. You will recall that I mentioned the issue of burden of care on the part of the relatives. Sometimes they need this psychological support on the part of the professionals. Then again, cognitive behavioral therapy is another important psychological treatment of patients with psychological complications of their physical illness. As I mentioned earlier, medication is the last resort. We don't rush to the use of medication in patients with psychological complications of physical illness. Medication should be the last resort. And when using this medication, we are very careful in the choice of the medication because some of our drugs, especially the heavy antipsychotics, can affect the physical aspects when an individual already has physical illness. So we are very careful in the choice of medication and the dose. Low dose medication usually suffice to treat such patients. And again, very importantly, we must always remember the relatives, the caring relatives, and we can also involve them in the psychological treatment. Thank you and God bless.
Thank you so very much. I am sure that Professor, rushed this because he is not done yet. But we have gone the long mile when you talk about this, the later psychological implication of physical illness. And the core point is the fact that we need to begin to understand that there is a connection. There's a connection between the physical and the mind. There's a connection between the mind as well as the physical. So thank you so very much, everyone, for being on this call with us. Yes, somebody asked about the support group. Some are free. We'll try and put a whole lot of some of this information on the Yaba Voice page. Just go to our Facebook page. You will see it, as well as the Instagram page. We'll put the information about some of the support group that we have. We would put it on the Yaba Voice page. But then Professor, I want you to quickly take this. Maybe that person wasn't here when we're talking, but I don't want them to just go away like not having the best of information. And maybe quickly in 1 minute, sir, how does our mental health affect our physical health? Professor, just in one minute, sir.
Well, as I mentioned initially, that the body and the mind, they are very much intertwined, that what affects the body can affect the mind, and what affects the mind can also affect the body. So mental illness can affect or can sometimes lead to physical illness, because when there is mental illness, depending on the severity of the mental illness, for instance, if a patient is psychotic and has no insight, this may make the patient to neglect the physical care of the individual, and this can invariably affect or cause some physical illnesses in the individual. So if a patient has a major psychiatric illness, psychotic illness, even with no insight, there can be neglect of physical care, and there can be neglect even of feeding, adequate feeding and hygiene, and this can lead to physical illness in the patient. Then again, if a patient is depressed, and severely depressed, this may also not make the individual to be energetic enough to take care of the self, and this can invariably lead to physical illness. And studies have also shown that apart from this, that sometimes the pathology causing the mental illness can also give rise to physical illness, especially if the focus of the pathology is in the brain. That sometimes this pathology causing the mental illness can also give rise to physical illness, and this has been known. Then I also mentioned, you will recall, I mentioned some types of illnesses which we classify as psychosomatic illnesses. So psychosomatic illnesses, they are physical illnesses with underlying psychological variables as leading to the cause of these physical illnesses. These are possible ways in which mental health or mental issues can lead to physical illness. Thank you.
Thank you so very much. I hope this individual now gets that link, the connection between mental and physical illness. Yes, thank you so very much for everyone who had reached out to us on this platform today. Professor Fatai Badru says, I like the glitch. Gene leads the gun, yes, but lifestyle pulls a trigger. And then the three form, thank you so much. It's just summarized his take home for today. And I hope quite a whole lot of us too had also had one thing or the other that we have added to our repertoire of knowledge that would help us to be able to move. Okay, questions are just coming in. Okay, 1 minute, since we have just 3 minutes left, let's just take this in 1 minute. Dr. Adigbite, why is it that the mentally ill patients do not usually succumb to physical illness? For example, infections, even when they are exposed. You can imagine a lot of them are on the road, and most times you find out that maybe they are, and we don't know. But why is it now? Somebody is asking. This is a very, very important question. Okay, Dr. Adigbite, let's hear you.
Well, when you are exposed to infections, death, you are likely to develop a lot of antibodies that others do not have. It is not that they are immune to all illnesses. If you look at them, there's two. It may be packed full of worms. However, for other things that they have come in contact with, viruses, bacteria, they might have developed a lot of antibodies, because the nature of human is that you will overcome that infection in time if it persists and does not go away and you don't treat it. So because they have been flooded with these problems, they have developed over the years a lot of antibodies, and that is what is sustaining them.
Thank you so very much. Because you see a lot of them on the street and they eat very dirty things, and it's like they really don't break down. But Dr. Adigbite had given us the answer to that. So I want to thank everyone who had been on this call. In 1 minute, we will take the last word from our presenters today, our speakers. Dr. Adigbite, let's have the last word from you, ma'am.
Thank you. Prevention is the key. Prevention is better than cure. At all levels, let us prevent illnesses, diseases, so that we will live healthier lives, and overall, gene will be kept in its place, and lifestyle choices will be the ones that are really determining how we are faring and the outcomes for us.
Okay, thank you so very much, Dr. Likwite. Professor Ino, the last word from you, sir.
Thank you very much. What I would like to say is that both physical and mental illnesses, they are illnesses that can affect individuals. I must emphasize that here that psychiatric illnesses must not be stigmatized. They are like physical illnesses and there are effective treatment for them. So when an individual is seen to develop psychiatric illness, either on its own or as a complication of physical illness, such individual must be promptly taken to appropriate healthcare facilities that are available for treatment to prevent further complications and mortality from such illnesses. Thank you.
Thank you so very much, sir, for that. Yeah, even when people have mental health issues, they must not be stigmatized. Part of the reasons why Yaba Voice is that we want to normalize a conversation about mental health in all dimensions. I want to make sure that, yes, people have access to care. That when you walk into the popular Yaba left, you still feel okay, like you're going into any normal hospital. Thank you so very much, sir, for that. Yes, Dr. Adekola says stigmatization kills more than the disease. Yes, oftentimes, yes, because the way people are labeled. Thank you so very much. Yes, the information about the support group will be sent out to the Yaba Voice platform, both on the Facebook page and on the YouTube page. Yaba Voice has a Facebook page and an Instagram page. One word, Yaba Voice. So please, please just look out for that. We'll send it out today by God's grace on that platform. So please just look out there. And then also we have a YouTube page where our past editions of the webinars is there, it's uploaded. So please, you can just go in and look at it. We've talked about so many issues, so many issues. You can just go back and look at a whole lot of some of these things that we had done in the past. And I'm sure that it's going to be a blessing for you. Yes, Ms. Adenyoju is saying take home for her. Thank you so very much for that. We hope that in one way or the other, we have been able to impact one or two persons on this call today. Thank you so very much for being on this call. Yes, G loads the gun. Yes, that's what I'm taking home too. I've noted it down. You may be vulnerable to it, but your lifestyle determines whether you would eventually break down or not. Thank you so very much. On behalf of the medical director, Dr. Wei, who is not here, and also on behalf of the head of clinicals, Dr. Oluwani, and every member of the Yaba Voice team, I want to say thank you for being on this call again with us this month. Hopefully, by God's grace, we will be with you next month, where we'll come with something very, very beautiful, something very enlightening, something informative that will help you to become more better and be able to cope so well, even with the adversity that we're facing at this time. Until we come your way again, please stay safe out there. The stressors are huge, we know that, but please let's develop adaptive coping skills that will help us to be able to function adequately. Please note that there is no health without mental health. Take care of your mental health and stay safe. Bye-bye. Take care.